For this investigation, I spoke with 11 sources, including parents of inmates and former employees at the facility. All but one of the former employees spoke on the condition of anonymity for fear of retribution. Meanwhile, the agencies responsible for the nearly 52,000 inmates from across the state have refused to go on camera to face our questions.
It's about money. It's about greed. It's political.
Debbie Whitlock is an attorney and county administrator in Northeast Georgia. She's also the mother of an inmate at Augusta State Medical Prison. Her son Anthony is in for drugs, but she says the time at the facility doesn't fit the crime.
The inmates are being abused. They're being tortured. They are put in solitary confinement.
Former correctional officers tell News Channel 6 that inmates are indeed put in isolation on the medical floor if there aren't enough beds, sometimes for weeks. Other inmates aren't lucky enough to survive, according to a doctor who worked at Augusta State Medical Prison for 16 years. Dr. Tim Young says that if an inmate has a serious condition, it may be months before they see a doctor. As of the last week of January, he says the backlog was at 1,000 requests.
But over the years, I've seen numerous cases like that where people died.
Internal emails document equipment failing during surgeries, the power going out during a urology case, and surgeries canceled because of the temperature and humidity in the building. One email reads, quote, "Flies have landed on the patient, surgeon, and sterile field more than once." Vicky Huff's son James Hood died at Augusta State Medical Prison in 2017. He entered the system with sickle cell disease. By the time he died 6 years later, he had lost an eye after an attack by other inmates. He had contracted hepatitis C, his kidneys were failing, and he experienced painful swelling of his genitals because of his sickle cell, for which doctors recommended castration.
To me, it was more torture than taking care of him. And can you imagine what they're doing with the other inmates?
Hood was sentenced for murder, but the judge never sentenced him to torture, as his mother alleges. So who's being held accountable? After conditions in the medical unit were brought to light a few months ago, the warden, Scott Wilkes, was reassigned.
This isn't something that happened overnight. Warden Wilkes didn't cause this.
Dr. Young says the facility really went downhill before Warden Wilkes took over in 2016, when Stan Shepard was warden.
And he has since been promoted to a higher level. But he was at Augusta State Medical Prison for 3 years. Over that 3-year period of time, that facility deteriorated.
Last year, Shepard made more than $100,000 a year as an assistant regional director for the Department of Corrections, a position created for him to oversee 16 facilities. That position didn't exist until 2016. Now there are 5 assistant regional managers. Between their salaries and travel, the positions cost taxpayers nearly $480,000 last year. All of them were previously employed by the department, but they also received raises upon this promotion. Shepard has since been promoted again to Regional Director of the Southeast Region, effective January 1st. Dr. Young and former correctional officers say the department really needs more employees and resources in places like Augusta State Medical Prison, where workers feel unsafe, the building is falling apart, and staff can't cover basic needs. Randy Stalls is the Assistant Commissioner of Health Services with the Department of Corrections. His position was created in 2016. He makes more than $126,000 a year. His solution to the problems at Augusta State Medical Prison? More administrative positions.
Then Augusta University is in the process of naming a new hospital administrator, and also the agency has created the position of Director of Environment of Care, which is a position that's going to be new to that facility to maintain the daily environment of care there.
Sauls tells me there will be no other added positions at the facility, just a commitment to an annual cleaning of the building. And we did reach out to Shepard and the Department of Corrections. A spokeswoman tells us it's not important to point fingers at this time and all issues are being addressed.